Hi, everybody. I hope you're doing well. This is Dr. Sean Casey at Healthcare Complete Back and Neck Pain Center, answering questions for our patients and the public at large. One question came through about high impact versus low impact exercise. Now, first and foremost, I'll tell everybody exercise is great. More importantly, finding an exercise that you like is great. Because if it's something you don't like, odds are you're not going to be doing it very long. That said, though, certain types of exercise, i.e. high impact, can cause a little more wear and tear on the joints in the body. So when we think of high impact, think of things like running, jumping, landing, certain plyometric-based exercises. When we think of CrossFit type of exercises, great exercises and activities, if done correctly under the supervision of a good coach or trainer, you can do a great job, but it does set us up for a few more injuries because they are higher impact. That means you've got that crunching, that impact on the joints. Same with running. When you out and do road work, anything where the feet come off the ground, essentially, there's going to be an impact point with that. And if we don't have the proper footwear, running on the proper surface, or doing the correct training, it can cause a lot of damage and wear and tear. In some cases, we always figure, well, it's a tough workout, I'm supposed to be sore. But there's a big difference between muscle soreness and fatigue post-workout, or boy, I'm really tearing something up. So a good thing to look at, say you are doing road work, we look at good footwear, so good shoes that are fitted correctly with the proper inserts to balance the arches of your feet can go a long way to correcting a lot of problems. So if you're doing that and you're with a good trainer using good form and technique, but we're still having these aches and pains, odds are mechanically something isn't functioning properly. Maybe it's the ankle, knee, hip, low back. All these areas can get thrown out of alignment. And now as we start putting more impact on that, the body responds by trying to protect you, creating spasm, but there's ripping and tearing. That's where inflammation comes from, and of course pain follows that. If that's repeated, if we don't listen to our bodies, a lot of damage is going to occur. Now, low impact exercise, more of things where we're doing feet down. So think of more an elliptical, a bike, things of that nature, as well as certain types of weightlifting and training. There's a lot of great exercises out there. We recommend you find one that you like. And if we are getting some aches and pains with it and you're not sure who to talk to about it, give our office a call. There's some companies and groups we work with that do a fantastic job coaching and training. Even some of our staff members are professional coaches in that manner, and they can help you that way. Well, if you have any questions, give us a call. We'll be happy to help out and get you on that path to health. Have a great day.